This interactive video aims to provide you with a simple and easy way or approach to learn the muscles that constitute the anterior compartment of the forearm, otherwise referred to as our flexors. Before I get started, I'd also like to acknowledge that some of the approaches and strategies that I've employed in this video are credit to the brilliant anatomy colleagues and mentors that I've had come before me. So there are a couple of important things that we need to remember when we're referring to the anatomy of the forearm. In general, the anatomy can be divided up into the flexor surface of the forearm, the extensor surface of the forearm, and then the mobile wad of 3. So this video specifically addresses the muscles that attach to the flexor surface. There are 3 important facts that we need to keep in mind when we're trying to learn the muscles that are located within the anterior compartment. Firstly, that there are 3 layers of muscles. So we have a superficial, an intermediate, and deep layer. Within each layer, there are 4 muscles. And then there is also going to be 1 important structure within each layer. So anatomy is best learned from deep to superficial, in my opinion. It then becomes intuitive. So I'm going to be starting off with the osteology, and then we're going to work our way up to the surface or the superficial layers. The diagram above then reinforces our knowledge of the major osteological landmarks of interest when we're looking at the elbow joint, as well as the major landmarks of interest on the radius and the ulna. It's important for us to remember the major principle that in order for a long bone to be able to rotate around another, it must be bent. And accordingly, when we're looking at the structure of the radius, we can see that the innermost margin is going to be relatively bent in comparison to the ulna. So as you'll recall from your knowledge of joints, the proximal radial-ulnar joint is a pivot joint. And remember that the head of the radius is going to be reinforced by the annular ligament. So the composition then of this proximal joint is going to then allow for rotation of the radius along or over the top of the ulna. So the key to the anatomy of the forearm is a couple of major osteological features, particularly on the radius. So firstly, we have the summit of the lateral convexity of the radius, which is going to be the most lateral point that is highlighted in our diagram. And we can see that if we had to draw an oblique line from this lateral most edge of the radius up to the inferior border of the radial tuberosity, this also then coincides with the anterior border of the radius, and we can call this the anterior oblique line in the current view. If we were looking at the forearm from a posterior perspective, we'd also then see the posterior oblique line, which is going to be important when we're talking about the extensors of the forearm. These lines and the muscles that attach to these lines will then help us to determine the layout of the forearm anatomy. A second principle that we should then be aware of is for the greatest mechanical advantage, a muscle or muscles that rotate the radius will attach to the summit of the lateral convexity. We will be coming back specifically to these muscles a little bit later on in the video, but when we're thinking about the arrangement and the shape of the radius, we could liken this to a bridge. So for example, if we were taking the Sydney Harbour Bridge, if we had a series of tugboats in Sydney Harbour and we wanted to pull the bridge over, best way for us to do this would then be to attach pulleys or apparatuses to the most lateral convexity, so the greatest point of the curvature of the bridge, in order to do so. The same goes when we're talking about bones. If we want to rotate a bone, we then need a muscle that's going to attach to the most lateral convexity of that particular bone in order to allow it to rotate to its maximum potential. So before we then dive into the muscle layers and their components, it's important for us to revisit the interosseous membrane, which is going to be a thin fibrous sheet that connects the medial and lateral borders of the radius and the ulna respectively. So collagen fibers within the sheet pass predominantly inferiorly from the radius to the ulna, and the interosseous membrane has a free upper margin which is situated just inferior to the radius radial tuberosity. We can also see that there's a secondary small circular aperture in the distal third. So vessels will pass between the anterior and posterior components superior to the upper margin and through this inferior aperture. If we're thinking about the function of the interosseous membrane, remembering that this is going to be classified as a syndesmosis, it is responsible for connecting the radius and ulna without restricting pronation and supination. It also allows us to provide an attachment point for muscles in the anterior and posterior compartments. The orientation of the fibers in the membrane are also consistent with the role in transferring forces from the radius to the ulna, and ultimately, therefore, from the hand to the humerus. Brilliant orthopedic surgeon and anatomist Dr. Tony Poll taught me a neat way to remember the muscles of the deep layer of the forearm using the rule of quarters. So the rule of quarters mandates that we have a series of reference lines. So if we had to draw a horizontal or transverse line intersecting the inferior aspect of the lateral convexity of the radius, this would then divide the shaft into halves. Further then, we have two additional reference planes that are going to correspond to the most distal quarter, and then we have the proximal quarter of the forearm. We can also create a secondary division down the mid-sagittal plane in an anatomical position by drawing a vertical reference line straight through the middle of the interosseous membrane. So using this grid then, we can try and locate the four main muscles that are going to constitute the deep layer. So the principles for the muscles of the deep layer of the forearm is that there's going to be four muscles. Of this, we have two short muscles and two long muscles. Each muscle is going to attach to at least one quarter of the grid that we've determined. Our short muscles are going to be on opposite ends of each other. They're going to perform opposite actions, and then the two long muscles are going to occupy the middle quarters of the bones. So remember, when something is considered to be deep, we can say that it's going to be profound. So this should then help us in naming some of these muscles. So the four muscles in the deep layer are going to be the pronator quadratus, the flexor digitorum profundus, flexor pollicis longus, and then we also have the supinator muscle. So firstly, if we had to look at the muscle that's going to occupy the distal quarters of the grid that we've drawn, so specifically the distal quarter of the anterior surface of the ulna as well as the radius, we have a square-like muscle. So we have the pronator quadratus muscle, and the primary action of this muscle is going to be pronation of the forearm, especially when we're looking at the elbow in a fully flexed position. We know that pronation by pronator teres is going to be minimized. Our other short muscle is going to be the supinator muscle. Supinator technically belongs to the extensor group of muscles and shares their nerve supply, but we encounter it here on the flexor side of the forearm to where it has extended. So for our purposes of discussion, we group the supinator muscle in the deep compartment of the forearm. If we're looking specifically at the supinator, it has a double origin, so it has both a deep and a superficial part. So broadly speaking, the origin of the supinator is going to be the supinator crest and fossa, as well as the lateral epicondyle and the radial collateral ligament. If we look at where it's going to then insert, specifically it's going to insert on the area located between the anterior and posterior oblique lines, and superficially, as we've drawn on this diagram, we can see it has an attachment to the anterior oblique line or the anterior border of the radius. As I mentioned before when we were discussing the general rules or principles associated with the deep muscle group, specifically the short muscles have opposite functions. So we know that pronator quadratus is going to be a prime mover for pronation, whereas supinator is going to be the primary supinator of the forearm with the elbow in extension. If we then turn our attention to the remaining space that's going to be available on the bone, we can see that using this grid that we've compiled, that the middle 2 quarters on both the ulnar and the radial anterior surfaces are going to be free. We know that muscles always attach to bone, so you never see muscle on muscle attachments. So as a result, we have 2 big muscles that are going to be responsible for flexing the distal interphalangeal joints of our fingers that are going to attach or originate from this part on the bone and the interosseous membrane. So specifically, if we're then looking at the muscle that's going to attach to the anterior surface of the radius, as well as the associated half of the interosseous membrane, we have the flexor pollicis longus muscle. So if we break this down, its prime movement is going to be flexion, so it has flexor in the word. Pollicis is going to mean it's acting upon the first digit or the thumb. Longus means it has a long tendon. So flexus pollicis longus is going to be attaching to the radius, which is going to be closest to the first digit, which makes sense. If we then look at what is going to be located on the ulnar side, we have our Flexor Digitorum profundus. Flexor Digitorum profundus is going to occupy the same area of bone, so the middle 2 quarters associated with the anterior surface of the ulnar and respective interosseous membrane. So as the name implies, this is going to be a muscle responsible for flexing the digits, so that being digits 2 through to 5. Insertion then of this muscle is going to be the base of the terminal phalanges of the fingers. The main action is going to be flexion of the distal interphalangeal joints and powerful rolling up of the fingers. You'll also recall that I mentioned at the start of this video that each layer has an important structure that is going to be of significance. Specifically, when we're looking at the deep layer, we know that the ulnar nerve is going to be passing posterior to the medial epicondyle of the humerus, and it is going to course with the deep compartment, specifically on the ulnar surface or side. This is also going to be responsible for supplying half of Flexor Digitorum profundus. If we're also then looking at the composition of the interosseous membrane, we know that associated with the median nerve, we have 2 branches being the anterior interosseous nerve and the posterior interosseous nerves that are going to course down the midline of the interosseous membrane and supply the adjacent muscles. So based then on the location of the anterior interosseous nerve, the muscles in its proximity, which is going to be flexor pollicis longus, flexor digitorum profundus, and then pronator quadratus, are also going to then be innervated by the anterior interosseous nerve. Moving on then to the middle layer, or the intermediate layer, there is technically going to only be one big muscle, but it has 4 individually functioning flexor tendons. This is going to be the Flexor Digitorum superficialis muscle. This large muscle has 2 heads, so the humero-ulnar head, which is going to originate from the medial epicondyle of the humerus, as well as from the adjacent medial edge of the coronoid process of the ulna. We also then have a radial head, which is going to originate from the anterior oblique line of the radius. We're then considering the proximal attachments of this muscle. They become quite obvious if we then had to review the picture that we've just drawn of our deep flexor group. So remembering then that muscle only will attach to bone, not muscle, we need to look for what areas of bone are still going to be visible or that muscle hasn't already attached to or occupied, and what bone can you then see is going to give rise to the attachment of Flexor Digitorum superficialis. So this is then going to be highlighted in green on the diagram. You may be wondering, well, why doesn't it attach higher up or more proximally? Because there looks like there is still bony areas available. However, we need to then consider the attachment sites for some of the major muscles that are going to act on the elbow, being biceps brachii, which will attach to the radial tuberosity. We also have the brachialis muscle that is going to then attach to the coronoid process of the ulna as well as the ulnar tuberosity. The specific insertion then for the Flexor Digitorum superficialis will be the shaft of the middle phalanges of the fingers, and the primary action is going to be prime flexion of the proximal interphalangeal joints. It can also be classified as a secondary flexor of the metacarpophalangeal joints. And like before, we mentioned that there's an important structure running through or coursing with this layer, which is going to be the median nerve. So the median nerve specifically, as well as the ulnar artery, will pass deep to the Flexor Digitorum superficialis between the two heads. And it's going to be the median nerve that then courses through the carpal tunnel along with the tendons of this particular muscle. Finally, we can then move on to the superficial layer of the anterior compartment. So there are going to be 4 muscles, and these are going to originate from the common flexor tendon that is going to attach to or give rise from the medial epicondyle of the humerus. So there's only 4 muscles that you need to know. These are going to be in order from lateral to medial, pronator teres, Flexor carpi radialis, palmaris longus, and then flexor carpi ulnaris. So collectively, if we're thinking then of the function of the muscles in this layer, we know that any muscle with the word pronator within it is going to be responsible for pronation of the forearm. So pronator teres is going to pronate the forearm. We also know that flexor carpi radialis and ulnaris are going to be responsible for wrist flexion. If we then illustrate pronator teres on our diagram, we can see that it's going to originate from the medial humeral epicondyle via the common flexor tendon. And we can see that the insertion or the other attachment point is going to be the summit of the lateral convexity of the radius. So coming back to our analogy of the Sydney Harbour Bridge and the shape of the radius that we spoke about earlier on in this presentation, the lateral convexity of the radius is going to be the maximum point of rotation. So by having pronator teres attached to this lateral convexity means that it has the greatest pull to be able to pronate the forearm. The other muscles that are going to then originate from this common flexor tendon as depicted on the medial epicondyle is going to be flexor carpi radialis. This is then going to insert onto the base of the second metacarpal. We then also have palmaris longus, which is going to insert onto the palmar fascia. And then lastly, running or coursing most medially is going to be flexor carpi ulnaris. This is then going to insert onto the base and shaft of the 5th metacarpal. So it's important to remember that no tendons insert directly onto the carpal bones. Those that will want to insert onto the carpal bones, so those that have the word carpi within them, such as flexor carpi ulnaris or radialis, will instead pass over the carpal bones and attach into the metacarpals. Of our 4 muscles, there are also going to be 3 tendons that we know are going to be visible at the wrist. So we should be able to see flexor carpi radialis, palmaris longus, and flexor carpi ulnaris when performing opposition of the 1st and 5th digits. A fun or interesting fact that the palmaris longus muscle is actually going to be absent in about 15% of the population. So if we then consider the innervation of the muscles in the superficial layer, they are all supplied by the median nerve except for flexor carpi ulnaris. So the clue is if a muscle has the word ulnaris within it, it's going to be supplied by the ulnar nerve. Specifically then revisiting the major actions associated with each of the superficial muscles, flexor carpi radialis is responsible for flexion of the wrist as well as abduction of the wrist. Flexor carpi ulnaris is also going to be responsible for flexion of the wrist, but it's also going to adduct the wrist. And then lastly, palmaris longus functions to tighten the palmar fascia. It is also going to be responsible for opposing shearing forces on the skin of the palm during gripping. The important structure then located in the superficial layer is going to be the radial artery. So this can then be palpated superficially at the wrist, and as we expect, it lies in the superficial group of muscles as it will course from the brachial artery to where it is palpated most distally and laterally. So I hope that this provides you with a way to map out the attachment points for the major muscles and the layers associated with the anterior compartment of the forearm. Thank you very much for your attention, and please make sure that you check out my YouTube channel for some more handy musculoskeletal anatomy videos.